we'll be recording. Yeah, so if you are not comfortable with having your image recorded, please turn your camera off. But we'll be posting this video to YouTube afterwards for the people who unfortunately can't make it to our live meeting today. But yeah,
Yep.
Sarah, take on.
Right, let's get started. Okay, so for today's meeting, we are talking about gynecological conditions, and we are very excited to have three amazing special guests. We will get into who they are later. So real quick, what is Invisible Illness Awareness Network? We are a nonprofit, a 501c3 nonprofit that raises awarenesses for invisible illnesses, chronic illnesses, and disabilities. And we help students start affiliate organizations at their schools so that they can be leaders and educate their peers, especially those who are pre-health or future healthcare professionals on invisible illnesses, so that when they become healthcare professionals, they know about these things. What is the Invisibly Aware Series? You're here. This is the Invisibly Aware Series. We hold 2 meetings a month. The first meeting, we have a presentation about the condition. The second meeting of the month, we have guest speakers talk about their experiences either living with or treating the conditions. And follow us. You can check out our Instagram and our website, and our link tree has everything else, including YouTube and how to contact us and all that. And sign up for our newsletter to get reminders for future meetings. Quick access check. You can turn on captions, and if there are any other access needs, please let us know, either email us or put them in the comments. And questions, please feel free to ask any questions you may have, put them in the chat, and we will do our best to answer them at the end of the presentation. Some quick disclaimers. This is not medical advice. If you're concerned about any of these conditions, please talk to your doctor. No two people with the same condition have the same experience with it. We're not experts on these topics, but our guest speakers are experts on their own bodies, so they know their personal experiences. Some takeaways. Symptoms of gynecological conditions are often similar, and causes are often difficult to pinpoint. There's not a lot of research out there about these topics. We need a lot more research. Endometriosis and adenomyosis are different conditions, but are kind of similar in nature. So endometriosis is endometrial-like tissue growing outside of the uterus, while adenomyosis is the endometrium, which is the lining of the uterus, going into the uterine wall. PCOS is a gynecological / endocrinological, I hate saying that word, condition that affects the ovaries, production of androgen, which is the male sex hormone. PCOS is often associated with ovarian cysts and insulin resistance. And always be kind to others. You never know what they're going through. I'll hand it off to Prabnor.
Okay, thanks so much, Sarah. So it's really exciting. Today we have three great guest speakers. First up, we have Dr. Gaby Moawad. He's a board-certified gynecological surgeon, also an associate professor at the George Washington University, and also the founder of CEAPS, which is the Center of Endometriosis and Advanced Pelvic Surgery. We're really excited to hear from him and just kind of get a better understanding of his work and experience with these conditions. And then also we have Tiffany Carpenter here, who's we're really excited to hear from her experience and just experience with different conditions. And then also our very own Stephanie Miller will be sharing their experiences as well. So maybe if we could start with just everyone giving a quick little introduction if they want to share why they're here and any fun facts that you would like to include.
I'll start off because we're also going to do a quick visual description for anyone who may be watching but can't see the video. So I'm Stephanie Miller. I'm one of the guest speakers today. I'm also the co-founder and co-president of IAN. I'm a white woman and I have shoulder length brown hair, and I'm excited to be here and share my experience with endometriosis.
Tiffany, I'll let you go first.
Okay. My name's Tiffany Carpenter, and I am from New Hampshire, and I am a white woman with shoulder length brown hair, and I'm excited to be here and share my story with all of you.
I'm Gaby Moawad. I'm a GYN surgeon that specializes in endometriosis and adenomyosis mainly. I'm from Washington, D.C. I'm usually on the race box other. So there are not enough races that describe on those race boxes. So we check others mainly. But I'm super happy to be here. Anything when it comes to endometriosis and adenomyosis, I'm really passionate about, at least to create some evidence-based and science-based understanding, because on the internet, on the Google, there are a lot of erroneous information, if I can say. So it's always good to fact check anything that you read, especially when it comes to endometriosis and adenomyosis.
All right, thank you so much for those introductions. I'll give a verbal description as well. I am Prabnor. I'm a South Asian woman with black hair, and I'm wearing a green sweater. And I guess we can jump right into the questions. Dr. Moawad, if we could start with you, if that's all right.
Of course.
Okay, awesome. So our first question is kind of just generally, what is your job? What area of medicine are you in? I know we touched on that a little bit in your introduction, but what conditions do you work with in a day-to-day?
So I'm originally, by training, I trained in OBGYN, but the last time I did anything related to obstetrics was 2011. So it's been 13 years. I do only minimally invasive surgery, GYN surgery. I'm an AAGL fellowship graduate of minimally invasive surgery. And then my area of focus nowadays are the complex pelvic surgery, endometriosis, adenomyosis, other conditions that might be related as well. I treat fibroids, but the main day-to-day practice is basically endometriosis and adenomyosis and pelvic pain.
Awesome, thank you. So how would you say your job helps people with endometriosis and other gynecological conditions on a day-to-day?
So there are different parts of our job. The first part is awareness and education. Any patient that comes to us with symptoms, the most important thing that we need to educate them or correct some of the concept they picked from the non-factual information or non-scientific factual information that I picked up from online. Empower them by the right knowledge so they can learn their body more and then understand their illness and understand the management option. And then the last portion, which is the surgical portion, we do surgery, but after the surgery is one portion of the endometriosis journey. I think we help orienting our patients going back to pelvic floor therapist, other practitioners that we work with or specialists that we work with, to make sure that they can have a comprehensive management of their disease rather than fragmented management of the disease, which is extremely important in our day-to-day practice to ensure that our patients understand the whole picture beyond just one act, whether surgical act or medical act or anything like this.
I really appreciate how you broke that down into the different stages, because I feel like sometimes when you hear about surgery, minimally invasive or very invasive, you kind of just hear about that main surgery part, but kind of the before, the education, mentorship kind of aspect, and the after post management is really comforting to hear, to know that there are physicians out there who are really focusing on that start to end. So that's awesome to hear about. Our next question is, what is most challenging about treating patients with endometriosis, would you say?
Well, there are a lot of challenges that we face every day. First, which I already mentioned a couple of times, is changing the beliefs that the patient had picked up from erroneous information, which is very important because nowadays there are kind of waves and some lingo that is utilized without understanding the definitions or understanding the meaning and the impact on the patients. So that where knowledge will become very powerful for our patients, make them understand. This is one of the main challenges to because patients are either stigmatizing the disease, they have beliefs that emanates from cultural, social beliefs that are extremely change the aspect of the disease and the impact of the disease on the patient. Because many patients think like, yes, it is normal. It's okay if I have, for example, pain during intercourse. It's okay if I have a little bit of pain during my period. It's okay. This is not bothering me. I want this, I want that. So trying to understand the priorities of the patient, understand the goals from the treatment, and at the same time making them aware of their body, the disease, connecting whatever they thought it's completely different and unrelated. For example, patients don't know sometimes that their bowel issues are related to endometriosis, or their breathing issues are related to endometriosis. Or when we talk about the nerves, their hip pain is related to endometriosis, their toe pain is related to endometriosis. So many of those patients had fragmented care throughout the years, and our job, the biggest challenge is to try to bring everybody together, try to make the patients gain control of their condition and understand it. Other challenges are the technical challenges that we face in surgery, and then the difficult decision making for some patients to reach, considering especially when we come to genital organs, whether fallopian tubes needs to be removed, whether the uterus needs to be removed in cases of severe adenomyosis, and then symptoms. So these are different kind of challenges that we are on an everyday basis. I think most of the patients that we deal with are overwhelmed, are gaslighted, and are tired from the medical system. So trying to reinstate the trust with the physician, trying to create that patient-physician relationship that would yield to optimal results is one of the biggest challenges with our patients.
What do you think is probably the most powerful tool to reestablish that trust so far that you've seen in your practice?
I think knowledge and education, and our patients are very clever. They did a lot of research. They've been battling, some of them, the condition for a long period of time. So when they come, they are really prepared and they did their research. But sometimes the research is kind of biased, because many times where they find the research is from marketing sites or from poorly scientific sites or from experts, between brackets, opinions. I believe nowadays the patients are confused because they think every doctor should be understanding this. And whenever we have doctors sometimes talking about endometriosis, if their medical language is not based on real science, is based on inspirational talks, emotional talks, that creates a lot of negative impacts on patients and their management of the disease. Because we have a lot of people that claim they are experts, but they're not, unfortunately. And there's no way, neither for a physician or for a patient to know. But what we can judge them from the information they relay, whether it is accurately scientific or not. At the end of the day, even if throughout my whole life I treated 10,000 patients, let's say, the literature covers millions and millions of patients, and science covers millions and millions of patients. If I have some really magical recipe and magical tool for endometriosis that is not present, my ethical obligation as a surgeon is to publish this in scientific journals so we can make it available to everyone. So my opinion does not have any value or have a minimal value when we compare to the larger pool of science and experience. So that's why I refrain from saying in my experience, in my surgical experience, I can note what I've seen, but this is not the guidelines that should be for every single patient. So these are stuff that we face on a regular basis.
Kind of going off of that idea of misinformation and lack of really scientific foundation to a lot of these things, what would you say are some common main misconceptions about endometriosis that you hear a lot?
One main thing is the disease does not recur, or I can cure a disease, or I can, my surgery is the best surgery ever. When I do it, there you will have no disease coming back. Now, we know that this, even in expert hand, the chances of recurrence is 2.7% for superficial peritoneal endometriosis, and but it is also 8.7% for endometriomas or endometriosis. So even if you are an expert in what you do, you should not claim this to the patient, because the cure of endometriosis, there is no such cure. It's a chronic disease. There's no cure for diabetes. Imagine you're going for the endocrinologist and they're telling you they're going to give you a recipe to cure your diabetes. These are chronic illnesses. We can help patients manage the disease better. We can help patients have a better quality of life with the disease, but we can done any surgery on a recurrent patient. So these are claims that create a false hope for a lot of patients. It might be great. These could be some marketing tools that some people utilize to attract patients to their practice. But I believe these are completely, this is a completely false information that does not, that we're doctors that continues to have continuous medical education to improve our ability to understand the disease and to help our patients in the best of our ability and what the science provides us.
Our next question was, what is the most impactful moment or an impactful memory you've had regarding endometriosis? I know it might be hard to pick one particular moment, but something that stands out in your career.
No, there are a lot of on an everyday moments that kind of impact you, and they're good, and especially mainly when you see the quick change in the quality of life of patients before and after the treatment that you do. But I have one particular story for a patient that she was not able to even walk. She was bedridden. She could not move her right hip. She's never had surgery. She went to a lot of orthopedic surgeons, so she traveled from faraway state to come and get surgery. And then I think one of the most impactful moment is when she sent a message on Instagram after her surgery that she ran her first 5K. It was 3 months after her surgery. So these are things that you would cherish with your patients, because at the end, the patients go through a lot, and it's not a cancer, endometriosis or adenomyosis, but the impact on the quality of life is many times patients cannot understand it because if you do have a cancer, you're doomed, or you have an end of your life that you can expect, that you can research. But with endometriosis, you feel like this slow dying every single month, this slow separation from your social relationship, there's slow separation from friends, self-isolating pain, everyday pain is a very powerful tool. They use it to torture prisoners and spies. So I believe that the poor understanding of a lot of patients lead to further isolation of our patients. But you can see that endometriosis pelvic pain patients are the easiest to treat whenever you understand what they have, whenever you listen to them. are the hardest to treat whenever you don't know what's going on. And that's why I hope that some of the practitioners could listen to this. If you have a patient with pelvic pain and you don't know how to deal with, please help her get through an expert or somebody who deal with her issues rather than, gaslighting the patients. Or it's okay to not know. I tell a lot, my patients sometimes ask me questions and I say, like, I'm so sorry, I don't know. I will do research and I'll get back to you. There's nothing wrong with that. There's something wrong when you try to create explanation for yourself in front of your patients that does not have anything. Or the worst thing for me, when you burden the patients with a lot of false diagnosis. So you have a patient at 25 years old carrying 65 diagnoses that were not proven, not diagnosed appropriately through the right channels. So these, if you tell the patient, oh, this is PCOS, you might forget as a practitioner, but the patient will never forget. She's going to go research PCOS. She's going to live all her life with a false diagnosis that is not even, and then everybody will start adding diagnosis. And that's why fragmenting of the care will lead to burdening our patients with lots of diagnoses, that most of them under one umbrella of endometriosis could be, or any other chronic disease. So I urge everybody, patients, to advocate for themselves and seek, if they don't find the right answers with the care, or the right care with the person who's providing them, find another one. And then for the practitioners, if you don't know what you're doing, if you don't know what you're dealing with, please refer patients to people that have better experience, not because they're better than you. No, you might be better than them in a million things, but because this is what they do, and they might know better in that specific area of medicine than you.
I really appreciate that transparency. I think one common theme we talk about in this club a lot is the power of a diagnosis, but I think that your point really emphasizes the power of the right diagnosis, and how the wrong one can be a huge burden. Your statement about how a patient will never forget that diagnosis and they'll carry it with them, that really spoke to me. So I appreciate that. I know we've talked a little bit about the power of education and really clearing up misinformation with people who come with endometriosis or adenomyosis. But if you could give advice to an endometriosis patient about what to do or not do, what would you say to them?
Well, the endometriosis symptoms or spectrum of symptoms is extremely different between one patient and another. So you cannot like replicate the same symptomatology for even the same where it is affected. The same, if you have, for example, endometriosis on the ovary, you cannot reproduce the same symptomatology. But for me, there are a lot of symptoms that are related to the disease. There are a lot of subtle symptoms that might be blamed on other organs related to endometriosis. For example, headaches. Headaches is something very simple. Patients think like, oh, they're having headaches during the period. Bloating is another thing. Non-specific symptoms. Hip pain sometimes is a very common symptom when you have ovarian endometriosis. Patient, they feel they're tired, they're not stretching enough, they're not doing a lot of things. I believe maintaining a diary is very, very powerful, because most of us tend to forget. We have an inherent recall bias, all of us. When you are in pain, you cannot think. After the pain period, you forget about your pain. And this is something that will make us continue to live, make us continue to carry on in life. But maintaining a diary is very important. Try to organize your medical record in a way, when you go to a new physician or where you get to a new referral, at least have a paper that summarizes all your story at the beginning, have all your record. Patients with chronic illness are highly encouraged to maintain a folder of all those visits, diagnosis, because unfortunately, many times the language that was portrayed to the patient, or the understanding of patient of a medical condition, cannot be explained through her language to another doctor. So we want to understand what happened precisely, so we can understand how to help them to the best of our ability. And sometimes the language does not reflect any valuable information for a doctor when it comes to accurate medical procedures or diagnoses that were done. So maintaining a diary of the symptoms, or and maintaining a good medical file that will summarize everything is key for patients with chronic illnesses in general and endometriosis specifically.
That's really helpful. Thank you. And our final question for you, kind of a little bit about your background, is how did you get into pelvic surgery? What drew you to this field? And like, what are your inspirations essentially?
So, I'm originally Lebanese, and I did my first residency in OBGYN in Lebanon. When I came back, I repeated another residency here, and I did another fellowship in minimally invasive surgery. What I wanted before is I was extremely interested in doing fertility as a specialty. When I came to the US, I thought, like, if we look at the main thing that's happening to a lot of patients when we do the gynecology, it roams around three major pillars. Roams around the fertility, the surgery, and the office and the diagnosis. So all these are all together. So I consider myself, I was attracted more to be a complete reproductive surgeon, where I can diagnose the problem, I can do the surgery, and I can help the patients reach to their goals. So with the advances of technology, I was more interested in the field of how I can do stuff more minimally invasive, how I can minimize the damage or the invasiveness of what we do to our patients, so we can promote better healing. And then that's why it shifted all my focus to do more surgery. And the challenges are with endometriosis are higher technical challenges, yet the reward are bigger. And then you can see how you can create all this circle, whatever inspired you to do obstetrics at the beginning, to be in contact with the most important for a lot of patients, the delivery, the babies event in their life. I wanted to be from the reverse way, or another way where I can improve the quality of life to the patients, to help them reach their goals, whether it is children if they wanted to carry pregnancy, or it is improved quality of life and relief from a disease. So that was basically the whole philosophy that took me through that road, and I'm super happy. I don't regret it. And 10 years ago, if you would ask me, would you do OBGYN again? I would tell you definitely no. And then now, if you ask me in your next life, what would you want to be? I want to be the same, because I think at the end of the day, I chose really something that I like, and I am challenged every day in my work in a positive way that keeps me going, following the latest advances, training other surgeons to do a standardized surgery for the complex diseases. So I would be me the next life, but in a better version, I hope.
That's awesome to hear. I know a couple of us on the call are interested in the pre-health profession field, so it's really great to hear about your path and how you got there. And also, thank you so much for your time. Those are the end of our questions for you, but if you'd have anything else you'd like to share, we'd be all ears for sure.
No, thank you so much. I think what you're doing, guys, is amazing. I believe that we need a lot of this community support, especially because the bureaucracy of changing anything through legislation and healthcare is way lengthier than the public changing things. So awareness and education, and then community support will help us go through a lot more faster through a paradigm shift rather than waiting for the policy and legislation and the approval. So what you're doing is invaluable, and I'm always here to support and help, and thank you for having me. It's a great opportunity.
Thank you
Thank
so much
you.
once again.
Yes, thank you so much. We really appreciate your time.
Thank you.
All right. And so now we can potentially switch over to our patient questions, if that sounds good, Tiffany and Stephanie.
For sure. Ready to
All
go.
right. All right. Thank you once again, Dr. Moawad. So we're just going to jump right in. And our first question, and Stephanie and Tiffany, please feel free to hop in. There's not necessarily like an order of who needs to speak. But our first question is, what is your experience with gynecological conditions, if you don't mind sharing? And what is your diagnosis, if you don't mind sharing?
Sure. So I have a long-standing experience with gynecological conditions. I personally deal with endometriosis. And yeah, I've been dealing with these types of symptoms since I was about 14.
Yeah, I've been dealing with a lot of these issues since I was 11, which is when I got my first period. So I have endometriosis, adenomyosis, PCOS, and I'm dealing with like fertility issues and stuff, and everything that comes with that. So like ovarian cyst and iron infusions because of abnormal bleeding, just all of that good stuff.
Thank you for sharing that. I was wondering a little bit about what the process of getting diagnosed looked like. How long did it take? I know it can come with ups and downs and a lot of long waits. So we just wanted to hear a little bit about that as well.
Yeah, for sure. So I was actually diagnosed via laparoscopy in August of 2022. It took, so doing the math on that, I was 14 in 2014. It took about 8 years for me to officially get a diagnosis. I've only seen 2 doctors technically because no one wanted to touch me as a child in terms of gynecological conditions. They're like, oh, you're too young to have anything dealing with your period and everything. It's like, it's, you're kind of exaggerating, like it's fine. But I couldn't find a gynecologist to really take me. So my mom took me to hers, and he's currently still my gynecologist today. Thankfully, my mom was a strong advocate for me. I know not everyone is in that type of situation. I only saw a second doctor when, I was started on low dose birth control back when I was 14, and eventually that wasn't enough for me, and, tried different birth controls and different treatment options. I only saw a second doctor when my current doctor decided that I didn't need an MRI to look into things further, and I saw a second doctor to get that MRI and brought it back to him, and he was like, oh, okay, this is not what I expected it to look like or expected it to be. So yeah, sorry, I'm trying to summarize because I know we have other questions to go into. But yeah, so I've only seen 2 doctors for it. And I have one main doctor, and yeah, it took a long time to get some help.
It's hard to summarize like everything.
I know. It's like,
Then,
okay,
like,
where's the last 8 years of my life?
right, exactly. And it's hard like when doctors say, okay, can you tell me like a brief medical history? And I'm like, how much time do you have?
Yeah, it's not brief.
Yeah. So I guess I started at the age of 11, like I said. They told me that I had thyroid disease and PCOS. And then at the age of like probably 15, I started getting like really painful periods. And it like kind of moved up towards my chest. I didn't know what was going on. They removed my gallbladder thinking the gallbladder was causing all of the pain and issues. And then that didn't help. So they gave me like colonoscopies and barium swallow, just trying to rule everything out that they possibly could. When I saw like every specialist in my local hospital, and they, all turned me around and said that there was nothing wrong. I did my own research, and I said, okay, well, these are my symptoms. This is what the internet's showing me. Maybe I should see an OBGYN for endometriosis. And I went to a hospital that's probably about 2 hours away from me. And they did a laparoscopic surgery, but instead of cutting out the endometriosis, they burned the endometriosis. And at that time, they also put in the Mirena IUD in, saying that that would be the only thing that would help the pain with endometriosis and the bleeding. And come to find out, that made everything, worse. But it's just been a very long few years, I guess I could say.
Yeah, and it sounds like you had to do so much like self-advocacy to really get to that
Oh,
point.
yeah. Yeah.
And I think that that's something we talk about a lot in like whenever we're talking about different invisible illnesses is just getting someone to listen to you, getting
Mhm.
someone to hear you, and the fact that you had to go find the symptoms and figure out yourself that, oh, should maybe see an OB/GYN, I'm sure it took a mental toll.
Oh, yeah. And it's still, a toll mentally. I think anybody who deals with endometriosis and having to advocate for themselves, and it takes a toll on you mentally.
For sure. Yeah, I missed a total of about 2 years of high school because of the the pain that I was dealing with every month. But it was so continuous, my body just got used to feeling in pain. So it was just like it just kept triggering. Yeah. So dealing with these issues in middle school, I was just originally diagnosed with primary dysmenorrhea, so like painful periods. And then, going into everything, it's like treatment options aren't working. You can't just throw birth control at a problem and expect it to go away. And just a lot of, again, like what Tiffany said, like ruling different things out. Like I had a colonoscopy endoscopy when I was 12 for a different reason, but they just, trying a lot of different things, trying to see what helps. I even did, I know I'm getting ahead of myself with some of the questions, but pelvic floor physical therapy was very helpful for me. That decreased my amount of pain by a lot. I started missing less school when I had that done. But yeah, no, there's so much that goes on trying to figure out what exactly you're dealing with, and especially when your physicians might not be as familiar with, especially when you're dealing with symptoms from multiple areas, like Dr. Moawad and Tiffany addressed, like dealing with like chest pain or like stomach pain or other things. If people aren't like super educated on various conditions and how they can be so encompassing, like endometriosis, which it doesn't sound like it is originally, but it's like it touches on a lot of different systems and a lot of different things. So being familiar with it, like education is a really important part of that. And hopefully as more education happens and people open their minds and start learning more about these things, that'll take less time to actually get help and get a proper diagnosis with treatment options to follow.
Thank you. Kind of going right off of that, Stephanie, talking about things that have made your condition better, things that have made your conditions worse in terms of treatment. I was wondering if you could both share a little bit about that.
Yeah, so in terms of better, it's been different stages for me because when I have different hormone levels now than I did as a 14-year-old. So certain things over time, like I started on low Western Phe, which is a very low dose birth control, and eventually that didn't work for me. So I had to move on to a next one, and then that one didn't work for me. So I moved on to a next one, and then it was only recently, like within the last few years, that it started getting bad again after being under control for a while in terms of pain. And I asked for other options besides, just birth control. It's like, what else can we do? Because like clearly, like my body keeps switching and it's not working. So that led me to getting laparoscopy and Mirena IUD placed, and that has helped me astronomically. I'm sorry to hear, Tiffany, it sounds like that was not your case. But for me, it has been life-changing. They found endometriosis. I only had stage 1. It wasn't super extensive or anything, but as we know, the stage of endometriosis doesn't necessarily correlate with the amount of pain that you feel. So I was obviously in high school, I dealt with a lot of pain, but it was very minimal. So I had that excised, and yeah, no, I've been almost like maybe average of like 1 day a month. I am dealing with a lot of pain, but I can manage that and I'm functional through it, and it's totally fine. Nothing like it was in high school for me. In terms of making it better, like I mentioned, the pelvic floor physical therapy, and then heating pad, pain medication, things like that. Worse, exercise also helps too. Like I noticed that the more active I am, the less pain I tend to feel, which makes a lot of sense. I played soccer like as a kid, and I didn't start having issues until I stopped playing soccer due to injuries. So that might have had something to do with it too. Making it worse, I guess overexerting myself, or uh, if I'm dealing with some other health conditions, like I also have POTS. If I'm dealing with a flare day, nothing generally pretty much helps, but I'm totally functional now, and I'm very grateful for all the opportunity I had to have all the treatment options that I did.
And this just shows that everybody that deals with endometriosis can have different symptoms or the opposite symptoms. Because, like, for me, I had the Mirena IUD in for 6 years, and it made my symptoms worse. And also for me, the pelvic floor physical therapy, it worked for a time being, and then my body, I guess, just got used to it. So everybody is completely different, but for me, the only thing that I find or found that works was definitely having the surgery with a endometriosis specialist and doing all my research when it comes to them, making sure that like they know, the facts and what they're doing. And even for me, I will ask the doctors questions that I already know the answers to, just because I want to make sure that they are, you know the right answers and that I can trust them with everything. So I think sometimes on bad days, like Stephanie had said, try not working out, but like taking a nice little stroll or, you know, moving, like stretching. I do have like an acupuncture mat, and some like cupping devices. I got that off of Amazon. I found that those two things definitely relieve some pain and pressure for me. But it can also make my bladder worse, which is also from endometriosis. So it's kind of like a give and take. I did try like a diet, where it'd be no red meats, no alcohol, no, soda, no caffeine, anything like that. And that did seem to work. But of course, it's expensive and sometimes you just can't keep up with it. So I just try little new things, and definitely having the endometriosis community here on Instagram, Facebook, whichever, has really helped me figure out what other little things that I can do to help the situation.
Yeah, for sure.
Thank you. Our next question is, what has your condition or conditions changed for you in terms of your life? Like, how is your life different now versus before you got the diagnosis?
I don't want to remember a time where I didn't have a diagnosis, to be frank. Like, that was not fun. Like, just the whole social isolation aspect of missing long amounts of school and having to do makeup work. Like, I didn't have a break in high school at all. Like, summer break, winter break, I was working through that, doing makeup work constantly. I didn't have a break until I graduated high school, albeit on time. I worked my butt off in order to graduate on time. But I was in pain so often. And yeah, once getting diagnosed and having the proper treatment options I found some that worked for me. I literally can't even imagine being how I was before. Like I said, like I deal with maybe one painful day a month, but manageable at that. And back in, like late high school, early college, I actually bled consistently for almost 2 years straight. Which was more inconvenient than anything. I wasn't dealing with the pain along with that necessarily. Like obviously every once in a while I'd have some pain, but now that I have the Mirena IUD and I had the endometriosis excised, it feels to me as if it's not growing back. Hopefully it continues that way, because it's been a year and a half so far, and I've been pretty consistent since the surgery and haven't had many issues. So I'm hoping it stays that way. But yeah, no, getting diagnosed and finding a treatment option that actually like works and is consistent has been life-changing, and I'm very grateful that I have found something that has done that for me.
Yeah, piggybacking off of what Stephanie said, I don't really remember a time, like where I was normal, I guess we could say, or felt normal. Um, I mean, I was a little kid when all this started, and I knew that something was wrong, and I would like, tell my parents or my grandparents, school nurses, people like that, and they just said, "Oh, it's just a period, suck it up, whatever, you're a woman." Um, but looking back, I think it was a it's been a good thing, but it's also been a bad thing because I feel like I've gained like confidence, and it makes me feel stronger as a person knowing that like I knew all along that something was wrong and then I have this diagnosis. But then it's also taken away like my social life, and I have a ton of anxiety because of all of the symptoms that come along with having endometriosis, and that holds me back from going out and experiencing new things, or the pain is can be unbearable sometimes and you just want to lay around all day on a heating pad or whatever you use. So in ways it's definitely worse than what it was, but I just have to like remain positive and know that I'm not the only one in the situation.
For sure. Having other people to talk to about it makes a huge difference.
Mhm.
For sure. And having a close support system. I don't know what your family life was like, but having my mom who believed me, I never mentioned this. She actually had endometriosis, and or currently has. I don't know. She hasn't had issues, fortunately, since she gave birth to me. So that's been great for her, and I'm happy. But if I had $1 for every time someone told me of like, oh, well, you can look forward to, not having your symptoms if you have a child. It's like, okay,
Mhm.
you don't, first of all, I'm 15. Um, like that's not a solution. It correlates with some people for sure. Like I'm glad that some people have had that experience, but that's not a cure. Like Dr. Mawad said, like there
Right.
is no cure for this. As of yet, fingers crossed. Recent research last June has been promising for, finding out reasons maybe why endometriosis develops, but there's so much research that still needs to be done, and research is so important in finding treatment options and other things. I'm very much looking forward to what comes out of the dedication. There's like a bunch of money that's been allocated for a women's health research in the US, so hopefully we'll see a lot of things come out of that.
Mhm.
um but yeah, just research is so important. I don't know, I'm going on a tangent now about other things, but uh no,
Now, I
it's just
think research is super important. I think it's even more important that other women know, and even doctors know, that a hysterectomy is not a cure for endometriosis.
yeah.
I think, I can't even tell you how many times I've been told, "Oh, either just have a baby, like you said, Stephanie, and it will, your symptoms will go away." Or the other end is, "Let's have a hysterectomy at the age of 17 before you even know what you're going to do with your life, and that will cure endometriosis." It's very frustrating. And that's something that I make sure that I tell everybody is like, there's no cure for endometriosis at all.
Yeah, it's managing your symptoms and finding treatment options that work for you that allow you to function in life and do your best.
Mhm.
It's frankly ridiculous how much it's pushed of like, oh, like have a kid or, get your uterus ripped out. It's like there should be more options than that. Like there needs to be more
Right.
options than that. Um, and yeah, that's not something anyone should have to, make a decision on, like a permanent decision on right away.
No.
Yeah, it sounds like from both of your stories, it's one end or the other, very extreme. And
Mhm.
I think there needs to be a lot more of that middle ground, and that's going to come from more knowledge and research. Because right now it just feels like very two options kind of thing.
I feel like it all circles back to education and research. Like
Yep.
it's all about, people, taking the time to know about things, not brushing patients off, advocating for yourself and making sure that, you're being taken seriously by people because it's a serious issue. It's like it's affecting people's lives. It's like I didn't want to stay home from school every other day. You think I wanted to not have a social life and only have school all the time? It's like I didn't want that. No one wants to be dealing with all of these things. We want help. And the best way to do that is to stay educated, do research, whether it be patients doing their own research or physicians and other scientists, going after research questions and finding ways to address a lot of these things.
For sure. Thank you both so much for that. I know some of this stuff is really personal and a lot of vulnerable information. So we really do appreciate you sharing that. My next question is, I know, Stephanie, you touched a little bit about high school and having to take time off. But overall, we're curious about what your experience has been in the context of institutional structures and whether you've received support from them or a lack of support when it comes to your day-to-day symptoms with endometriosis. So what I mean by this is like whether that's in the education sphere, like high school, or in the professional sphere like a job. Do you feel like there have been structures at the institutional level to provide support for your symptoms and your day-to-day?
Tiffany, do you want to start with this one? Because I have some words that I need to form in a better way.
Okay. For me, I honestly, growing up, my parents, I shouldn't say that they weren't supportive of it, but they called me weak and they said that it was just a bad period and all kinds of things like that. And that even eventually led into like middle school, high school days. And then it formed into, colleagues at work and stuff. And I just really wish that more people were aware of endometriosis and what comes with it so that they have a better understanding of what we go through. I would be taking like, so for the longest time, I bled for 3 years straight. I ended up having to get iron infusions weekly. They ended up putting like a PICC line in my arm because they couldn't get any more blood from the veins because they were all blown and everything. So I don't even know where I was going with that. I lost my train of thought.
All good. All good. We
Support.
just, anything you want to share? Yeah.
I think you were going on the thing of family support and how, no, I'm forgetting too.
I know I have like so much information in my brain right now. I just
Yeah,
can't.
it's like I'm not even saying like 10% of what I'm thinking. It's like it's all too much. Like I can't describe 8 years to you. Like it's too much.
Yeah, it's been a crazy 8 years or whatever, for anybody who's been through this. And I just wish that people had more support. And I just wish that colleagues would understand what you go through. I was being bullied at work because I was constantly calling out because of the bleeding, the iron infusions. I had 3 surgeries dealing with endometriosis. I've had a DNC, all kinds of stuff. And I just wish that people would understand, that we're not faking this, we're actually truly in pain and we need the support and help.
Yeah, for sure. I don't think institutional structures in terms of like schools, especially like primary schools, have the experience or knowledge or frankly even the time to deal with things like this properly. It's like I wish I had the support I needed in middle school and high school when I started dealing with these issues. Just so like, it was a whole fight in itself to, advocate for myself in terms of, having extensions on work because I missed a solid week of class and not taking the test on Friday because I haven't been here for the past month. Like that kind of a thing. I did get an IEP eventually through school but that was only due to talking to other people and learning that it was even an option. And, it was a whole process within itself to get help through the school level. It was, the backing, having my mom be of support was like the core, reason I did what I did and, was able to self-advocate and talk to teachers and be like, hey, this is what I need. This is what I'm dealing with. As a 15-year-old, it's like that's a very difficult conversation to have with teachers, especially like with this being a personal issue. It's like you're still going through puberty, you're still doing like a lot of different things, so being open and honest with teachers was difficult, not having certain things in place. But I think generally we're going in the right direction with support for students. I think parents are a lot more vocal than they used to be, and it's just it's something that takes time. Like Dr. Moawad said, like the best thing that we can do is, educate ourselves and keep up to date with things, but policies and things in place take a long time to establish and have support with. So there definitely needs to be more in both a, school aspect, education aspect, professional environment, and just, it all circles back to like, be kind to people. You don't know what someone's dealing with. It's like, don't assume the worst about people. And people are trying, like we have to like remember, like no one wants to be dealing with all of this. It's, it takes a lot of time, and you don't want to spend time on things. Time is precious in this life. We don't have a lot of it. So, yeah.
Kind of going off of that in terms of, I know we've talked a lot about how support is really important, especially during the diagnosis process and dealing with the day-to-day symptoms. I was wondering, what advice would you give to someone who's newly diagnosed or suspected of having a gynecological condition, like at the beginning of their journey, essentially?
I would, oh, do you want to go, Stephanie?
No, you're totally good. Go ahead.
I would just say, don't give up. You know your own body. Stick with what you believe, follow through with it, and do your own research. Like, even if a doctor tells you that they specialize in endometriosis, research their background. Make sure that they actually know this information. I went through 4 people who claimed to be endometriosis specialists, but honestly, they didn't know the right information, and they made situations worse. And when I found this one doctor for the last, I don't know, 2-3 years, he's absolutely changed my life. He's amazing. So just follow your gut, and just advocate for yourself is all I can say.
100%. I'm on a very similar vein here. Like, your body best. Trust yourself, and trust your feelings. Like, don't let yourself get gaslit thinking that this is all in your head. I had like my pediatrician. I've had some great doctors, don't get me wrong, but at the beginning of my journey, I had my pediatrician say that I was making up my issues to get out of school. As someone who is a major nerd and like loves academics in general, it's like, yeah, no. And my mom was like, yeah, no, that doesn't match with what they're dealing with. You know your body best. Same with I actually had my current doctor. He told me, he's like, well, you shouldn't be having all these issues. I'm like, well, yeah, duh. But you haven't been ovulated since you've been 14. And I'm like, whoa, whoa, whoa. Like, I know that we're supposed to be suppressing that with, birth control and other treatment options, but I'm like, I definitely have been. Like, there's no way that I haven't with all the pain that I'm dealing with. And he initially refused getting an MRI for me. So that's why I went to a different doctor and got the MRI done. And he's like, oh crap, you're right. You literally are ovulating in this MRI. And I'm like, oh, yeah, great to know. Like, you know your body best. Like, trust yourself and advocate for yourself if people are dismissing you. Like, I was dismissed by that doctor, and I'm like, you know what? I'm gonna find someone to actually get me, a test done and not dismiss me without even doing a test. And it turned out I was right. So it's like, you know your body better than your doctor does. That doesn't say don't listen to your doctor necessarily. Like, you have to find someone that they know more than you do by far, but find someone who actually knows what they're talking about, is truly a specialist in the area that you need help in, and don't be afraid to seek out other opinions.
Right.
I think is a really big important part of that. It's like it's okay to get a second opinion. There's a reason why people do get second opinions. It's just to make sure, it's like double check, be like, is this really true? Like, just, people can make mistakes, and sometimes people are more knowledgeable in certain areas than others. So
It's okay to get a 3rd and 4th opinion too.
yeah, it's okay to get 3rd and 4th. It's like, it's okay. This is your health. This is your health. This is your body. And you deserve to get to the support necessary in order to function in life.
Don't give up.
Don't give up. Yeah, that's a big one. It's like, again, like years. It took us years to get the help
Mhm.
that we needed. And hopefully in the future, it will not take people that long, but we're not there yet. And stay determined. There is a way to get help. At least, make your symptoms a little bit less at the very least. So
And reach out to people who've gone through this too. I mean, there's a ton of like Facebook groups, Instagram, blogs, whichever. And, reach out to those people if you need somebody to confide in or ask weird questions or strange questions, whichever.
For sure. And be wary of misinformation.
Yes.
Make sure your sources are actual sources and not someone's blog post ranting about XYZ.
Mm-hmm.
And finally, if doctors were to know one thing about gynecological conditions from the patient perspective, what is one thing that you'd want to share with them?
Please believe your patients when they tell you they're in pain. Like,
That's what I
just
was gonna say.
it's the biggest thing. It's like, please believe us. I understand that doctors deal with a lot of, you know, there's a lot of different issues in healthcare overall. Like, some people are drug seeking, some people are, you know, wasting time and hypochondriacs. I get it. I get it. You deal with a lot, but please try to like hear people out and let them talk to you and just be an ear to listen on at the very least, and work together to find something that works for both parties. Yeah, just believe and listen, please. And if they could know anything about gynecological conditions, I wish they could know all of the accurate, updated information instantly. If we could just, you know, zap that into their brains, that would be great. But I know it's not that simple, and there's a lot of moving pieces that we obviously don't know about as patients too, but just, you know, please listen.
Yeah, that's what I was gonna say. Don't doubt your patient.
That's a really powerful note to end on, I think. Thank you so much, both of you, for sharing your personal experiences. We really appreciate it. And I know I learned a lot. Hopefully others did too. And I just want to reiterate, we're really grateful for everyone being here today. Thank you.
Thank you.
Thank you.
All right. So just to close out, we can put our socials hopefully on the last slide.
Maybe. There we go.
Yep. Thanks so much, Sarah. Yep. So right here is our social media information. So we have our Instagram up there and the website and a link tree. And you can scan the QR code as well to access the link tree. And then you can find our events calendar and newsletter sign up there as well. But thank you so much to everyone for the information today. And yeah, if anyone has anything else they want to add or share, any questions, this would be a great time if you want to drop into the chat or just unmute.
Yeah, and I'm an open book in regards to anything, so any questions regarding anything.
Go to that link. It's slides.app.goo.gl/NAEI2. Sorry for the weird link, but that's how Google does it. You can ask anonymous questions there if you prefer to ask anonymously. Or feel free to direct message me and I will not share who asked.
That works too. But again, thank you Tiffany, thank you Prabnor, thank you Sarah, thank you Dr. Moawad for your time today and for, you know, helping host this meeting and just share your expertise and personal experiences with us. We really do appreciate it. And like it kind of circles back to, it's like education and awareness is like step one, and hopefully you know, we can continue working towards that and having people you know, just keep learning more, keep doing research, and